Good morning. I'm Dr. Michael Ennis, and I run a wellness clinic here in Houston. We're a group of upper cervical specialists. That's a specialty in chiropractic that deals with the, uh, the top part of the spine, the atlas, and how it relates to the occiput, your head. And one of the big things we see is a lot of the difficult cases that people don't often see. And today I'd like to talk to you about something that we see very often, and that is brain fog. People come in oftentimes saying that they can't concentrate, that their head feels foggy, they don't feel as sharp as they normally do, and for some, it's actually quite a big deal. And there's some really great research that's been going on the last few years on how the chemical that nourishes our brain and spinal cord, which is not blood, but it's called CSF or cerebral spinal fluid, how it flows. And when the upper cervical spine uniquely is out of its proper orientation, it actually can impede this flow. And so the brain doesn't get this nourishment as well as it should. There's pressures that builds up. There's a real neat study on migraines that relates to this pressure building up. And it's very often that they will complain of brain fog or this sense of not being sharp and not themselves. So we see this really, really often. And this is actually kind of a big deal. So if you notice that your head's tilted off, or if you feel like, when you sleep, you can never get the right pillow because your neck feels uncomfortable, that might be a sign that there's pressure at this upper part of your spine. So it's something that you can be thinking about, and look at your lifestyle and see what your head position's like. Again, this is Dr. Michael Ennis with Ennis Chiropractic. Thank you very much.